The people who are here with us at this point, I want to say at the outset, every New Yorker should be proud of the leaders of our city agencies who have responded with extraordinary ability. We should be very proud of the men and women who have done the work of addressing this crisis, the months of training and preparation that our city employees and our partners in the voluntary hospitals have put into this effort has paid off. The principles were extraordinary. The leadership exhibited by the individuals surrounding me today, time and again, proved to be ahead of the crisis, and that's why we have the situation under control, because they planned for months and they've been working with extraordinarily capable New York City public employees. I want to thank our Office of Emergency Management. Commissioner Joe Esposito has done a tremendous job bringing all of the pieces. There have been many, many city, state, nonprofit agencies, obviously our partners in the federal government, all working together. OEM has been right at the core of that, and Joe has been one of our lead spokespeople throughout this crisis, explaining to New Yorkers and to the country what's being done here. I want to thank him for his leadership. I want to thank FDNY Commissioner Dan Nigro. EMS drilled for quite a while, knowing the day might come when they had to receive a patient with Ebola. The process played out exactly as the protocol dictated yesterday. The teams were drilled. They executed exactly correctly. And I want to say to Commissioner Nigro and his whole team, I commend them for their professionalism and the preparation that led to such a seamless transfer of the patient yesterday. I want to thank our police leaders who are here, Chief Banks and Chief Waters, for their leadership and the close coordination with the NYPD throughout. And I want to talk about our healthcare leaders in a moment, who you will hear from, who have been exemplary. We've kept in close touch with elected officials representing all neighborhoods of New York City. I want to thank them for their support. Hold on one second. Could we get that settled over there? I want to thank them for their support and their efforts to inform the public, to help make sure people had information they needed when they needed it. That's been extraordinarily important to our effort to get clear and consistent information out. I want to thank all elected officials who have been part of this effort, but particularly those who are with us here today. New York City Council Speaker Melissa Mark Viverito, Public Advocate Tish James, Comptroller Scott Stringer, Brooklyn Borough President Eric Adams, and Manhattan Borough President Gail Brewer. I want to thank them all for their partnership. Now let me emphasize what we have here in New York City that's so crucial in this dynamic. We have the finest public health system, not only anywhere in this country, but anywhere in the world. It's a public health system that has been developed over decades. It is ready for extraordinary challenges, and it's proving it as we speak. We are fully prepared to handle Ebola. Our medical experts here in the city have been studying this disease intensively and working closely with our federal partners, and going so far as to consult with doctors in other parts of the country who are on the front line, including in Atlanta and Nebraska, who have directly treated Ebola patients. The partnership with the federal and state government has been consistent and seamless, and that has been very helpful in allowing us to know every precaution that we had to take and every type of preparation we had to undertake. And we've had clear and strong protocols from the beginning, and they have been followed to the letter. The patient who tested positive was taken to Bellevue following those protocols. From the moment the call came in, the process proceeded exactly as dictated, interviewing the patient, getting the facts, having an EMS team that was specially trained, receive the patient, the handoff at Bellevue as the training dictated. Patient's now being held in isolation at Bellevue and poses no threat to others. The health department's team of disease detectives, that's a very important point. The health department has a team of experts who act as detectives would in a police investigation. They go and retrace all the contacts that the patient has had, and they're trained to do so. They have been at work since the report came in, retracing all the steps of the patient. And we'll have a detailed delineation of those findings later in the day. The patient's fiance is being quarantined, and we are, as always, looking at each individual contact and determining whenever quarantine is necessary. We know, as was said last night, the patient took the subway, went to a bowling alley, and went to a few other food establishments before being admitted to Bellevue yesterday. We've been able to retrace those steps. Our teams have visited each of those establishments. And I want to emphasize again, casual contact cannot lead to acquiring this disease. The only threat is if one has come in contact directly with the bodily fluids of someone who has this disease. Before I turn to my colleagues, I want to raise one important point, because people in a moment of crisis always ask what they can do. What should they know? And I think it's important that we help New Yorkers understand the very crucial information they need. We've made clear all the things that Ebola is not, all the ways it does not transmit. But that still does not mean people can't do something to help in this crisis. First, if you or a loved one feels you may meet the qualifications, meaning you have traveled to the 3 countries in West Africa that are afflicted in the last 21 days, and you have a fever and other symptoms, it is crucial to call 911 immediately. Or, the only other alternative, go immediately to a hospital emergency room. I want to emphasize, those are the only 2 acceptable actions. Call 911 or go to a hospital emergency room. Do not wait, do not hesitate, do not wait to see if you get better. Do not go to a private doctor's office. Call 911 or go to an emergency room. If a loved one you fear may be afflicted and fits those criteria, call on their behalf to 911 or bring them to an emergency room. Again, we have no other cases reported, but it's important that people understand that is the protocol. Second, we have to make sure that our medical professionals can focus on this crisis properly. They don't need to have false reports or misleading dynamics clogging up their efforts, which leads to something that every New Yorker can do if they haven't already, which is to get a flu shot. Sounds counterintuitive at first, but it's very important, because when you have the flu, it can seem like some of the same symptoms as Ebola. Every New Yorker who gets a flu shot, not only does it help prevent flu for them and their family, it also helps our medical teams to not have to deal with something that may falsely indicate Ebola. So that is something that literally every New Yorker can do. If you have not gotten a flu shot, it really will help us to address this public health situation if every New Yorker goes now and gets a flu shot. I've gone over the precautions that people should take, such as a flu shot, or if there is a situation, to call 911 or the emergency room. I want to just say a few words in Spanish and then turn to our medical professionals. Ayer anunciamos que un paciente dio positivo por Ebola en el Hospital Bellevue. No hay necesidad de alarma. Ebola solo se puede contraer por contacto directo con sangre u otros fluidos corporales de una persona infectada. Nueva York tiene el mejor sistema médico del mundo y se están tomando todas las medidas para proteger a los neoyorquinos. With that, I want to turn to Dr. Bassett, who I think last night did an extraordinary job explaining to New Yorkers and to the whole country the steps that were being taken. But much more importantly, for months she has led the efforts to prepare, and her leadership has been invaluable in making sure this city was ready to handle this crisis. Our Health Commissioner, Dr. Mary Bassett.
Thank you, Mr. Mayor. I want to begin by acknowledging that this has really been a team effort within city government across numbers of agencies, including our public hospital system, the Health and Hospitals Corporation, the fire department, which oversees the emergency medical services, with OEM, which is so critical to ensuring that everyone is coordinated in this response, and many other activities. We've all worked together. We've also benefited from close collaborations with our state health department and with our federal partners at the Centers for Disease Control, and we have today Dr. Rima Kabas, who's joined us here in New York from the CDC. I have the timeline that I talked with you about yesterday evening. We know that the patient continues to be stable at Bellevue Hospital, where he remains hospitalized on the isolation unit in an intensive care unit setting. And so we're pleased that he continues to remain in stable condition. We have some new information from the CDC. They are confirming his Ebola test so it is also positive, so he is now a confirmed Ebola patient. We know the outline of this patient's whereabouts. He is a doctor, as you all know, who valiantly volunteered to work in Guinea, where one of the countries where the Ebola epidemic remains ongoing and is the major source of Ebola cases, along with Liberia and Sierra Leone. He was working to end the epidemic at its source, a truly courageous young man. We know that he returned to the United States on the 17th of October, and he came back via Europe to JFK Airport. We're going to be making public the whole timeline for you later today. I have very few additional details to give you today, but they include a little bit of clarity about where he went. On the 21st of October, at the time that the patient first experienced some symptoms of fatigue, he visited the High Line and the Meatball Shop, popular restaurant. On the 22nd, the patient went running. He made that 3-mile run that I mentioned and ran along Riverside Drive in his neighborhood. And he also visited the bowling place in Williamsburg, taking the A train and the L train to reach it and going to a place called the Gutter. And then he reported for the first time one of the series of symptoms that we know are common in Ebola, the most common one being fever. He had a temperature of 100.3. I think I clarified last night that the number 103, which was quoted in many media outlets, was incorrect. The patient never got it wrong. It just got conveyed in the wrong way. And he, at that time, did exactly the right thing. He contacted MSF, Doctors Without Borders, with whom he'd been volunteering in West Africa. They contacted us immediately, leading to the smooth transfer of this patient by EMS to Bellevue Hospital. We have visited the bowling alley, and after we have a person diagnosed with Ebola, the next step is to unleash our medical detectives and go out and talk to the patient first and then carefully verify his story as best we can. We want to find every person with whom he may have been in contact, and we want to account for all of his time from the time he developed symptoms till he was safely placed in isolation and in care at Bellevue Hospital. We have visited the Gutter and verified the events, and the place has been cleared by our health department for opening. We are in the process of visiting, in fact, staff are there now, the food service establishment that the mayor mentioned. that really is the additional information that I have to give you today, in addition to the information that was given to you yesterday evening.
Thank you very much, Doctor. I want to say, as I turn to Dr. Raju, that Bellevue Hospital, I think all New Yorkers feel a particular pride in Bellevue because of what it has shown us year in and year out, an extraordinary capacity to handle every type of crisis, including the absolutely heroic efforts of the Bellevue staff after Sandy hit. Now they are on the front line again, but they are thoroughly prepared. There's, I think, no hospital in the world more able to handle crisis than Bellevue. And I want to thank Dr. Ram Raju, the president of our Health and Hospitals Corporation, for his leadership. Bellevue is his flagship, and he runs the entire system. The entire system has been prepared, but the staff at Bellevue deserve our special appreciation at this moment for the way they prepared and the way they are handling the situation day to day and hour to hour now. Dr. Raju.
Thank you, Mr. Mayor. And I've been in healthcare field over 30 years. I never seen such an unprecedented collaboration between agencies. The proof is yesterday when we were able to successfully take a patient from the community to an isolation room of Bellevue Hospital in a seamless fashion with no panic. Ability so basically shows two things. One, collaboration, cooperation works, practice works. We have continuously drilled on this, and it works. Now the patient is at Bellevue, and I am absolutely confident he will get the excellent care he deserves at Bellevue. We have a great people who are taking care of him right now. So at the present time, our goals are two. One, we want to provide excellent care for our patient, and we also make sure to protect our employees so that they take adequate precautions as they take care of this patient. So I'm absolutely confident that both will be achieved, and I really want to thank you for the confidence you have in the your public hospital system, and especially, and we are ready to take care of this patient.
Thank you, Doctor. And as we've said throughout, we have been in constant contact with the Centers for Disease Control. We have benefited greatly from the expertise that they've offered, and as new information comes in on a daily basis to better prepare ourselves, CDC has shared with us constantly, and CDC officials were at Bellevue yesterday as events were unfolding, and we appreciated their assistance. We have with us the Deputy Director for Infectious Diseases and Director of the Office of Infectious Diseases at the Centers for Disease Control and Prevention, Dr. Rima Kabaz.
Thank you, Mr. Mayor. I flew up last evening with two senior colleagues, and we're pleased to be here. Additional team members will be joining us today, including experienced staff who have worked in Africa and in Dallas. We are here to assist the city and health department. We are still getting caught up. We actually participated in a meeting this morning in their emergency operating center, and quite impressed. We know how prepared they are, but quite impressed with the incident management system and with how much has been done so far. So, like I said, we're here to assist, and we will be working very closely with them.
Thank you very much, Doctor. Again, emphasizing we will take questions on this topic only. Melissa.
Mr. Mayor, or Dr. Bassett, you've said that Dr. Spencer's temperature didn't rise until Thursday morning. But we
Yesterday morning, yeah.
Yesterday morning,
Yep.
that's right.
So we also know that he was feeling fatigued for a day or
Yes.
two before that. So before yesterday morning, when was the last time that the doctor took his own temperature? Was it after the bowling alley? Was it before? Are you sure he was taking it? And, what was that temperature?
Sure. So let's remember that this is a medical doctor who was actively engaged in treating patients with Ebola, working on an Ebola treatment unit in Guinea. So he last was in contact with patients on the 12th of October, and then began what is often referred to as active monitoring, taking his temperature twice a day. So he was feeling well, had no fever at the time that he left Guinea, which was on the 14th. He continued to feel well with his onward travel from Europe to the United States, where he arrived on JFK on the 17th. And he continued to check his temperature daily. The first time that he experienced fever was on Thursday morning, sometime between 10 and 11. He measured his temperature as 100.3. This is a low-grade fever. When I was an intern, 104.4. That's how that mistake happened, what I just said. 100.4 was the sort of only above that did we trigger the idea that somebody had a fever. So he had a low-grade fever, and he immediately notified. We know that people with the symptoms of Ebola, the most common of which is fever, and also includes muscle pain, severe headache, vomiting, nausea, diarrhea, that all of these are associated with the onset of contagiousness.
May I just follow up there? Do you happen to know what time, the prior time that
The actual, I know that he checked his temperature on Wednesday, the last time before then.
She's asking, we know what time.
Do I know the time of that? I don't know it. That doesn't mean it's not knowable, but I don't know it.
But Melissa, just to clarify before you follow on, obviously the doctors can further elaborate, but the history here is that people have only transmitted the disease when they had a state of fever. So that's why it's crucial that we did not have a confirmation of a fever before yesterday morning, and it was 100.3 at that time.
So when you say you want to know all of the contacts since he became symptomatic, are you counting symptomatic as after he took his temperature yesterday morning and had fever?
No, before.
Or
Before.
No, we, in the abundance of caution, we've been tracking down and seeking to account for every minute since 7 a.m. on October 21st.
Please.
Mayor, it seems like there's a very limited number of people who could actually bring Ebola into New York City,
Yes.
particularly people who are coming into contact with patients. Should there be greater protocols to screen people before they actually get here?
Well, I'll turn to the CDC. I'll only say that what's clear is there have been additional restrictions and protocols put into place. Clearly, a lot more monitoring is happening, both of returning health professionals and any individuals from those nations. And I think that's crucial. Look, when this crisis began, we did not have the example here in this country of dealing with this particular problem. In the last few weeks, the protocols have improved greatly. The ability to address the situation has improved greatly. And you see, and I think just looking at the juxtaposition of what happened in Dallas versus here, and I have a lot of respect for our colleagues in Dallas who were dealing with the crisis much earlier and without as much information as we now benefit from. But it's an entirely different situation when you're prepared. So now that I think we're in a position to constantly monitor any individuals, there may be a question mark, that's changing this profoundly. Doctor, do you want to add? Or?
Yeah, we have protocols in place, and we've had them in terms of returning healthcare workers and exit screening. And as you know, we've actually increased our protocols for screening, entry screening, and active monitoring. So it's in place, and we continue to learn and improve as needed.
Just to follow up on that, I mean, the doctor did clear the actual screening process when he actually did come in. And given that he is a doctor who did deal with Ebola patients himself, what happens when you end up getting an Ebola patient who ends up coming in, does not have the enlightenment of being an Ebola doctor and just is a regular person who doesn't have that education and just thinks that he has the flu? Can you talk about that?
Yeah, our protocols for screening include, as I said, this active monitoring. So people are told and are monitored for symptoms and
just
fevers.
To clarify, if I may jump in, we're going to be monitoring in accordance with the instructions of the CDC. We and other localities are going to be monitoring an individual who has from those nations. So we're going to be directly doing the monitoring.
Which meatball shop location did you go to? What time?
Do we have the?
We have the timeline. I can't give it to you right now. We have the timeline.
We're going to give you the TikTok
We'll give you
in the
the
next few
TikTok.
hours. But just to clarify that our personnel from OEM and Health Department are at the location,
Yes.
doing the same exact process that they've done at the bowling alley. There was also a coffee shop. They're at the coffee shop now. So they will go through the investigatory process, and if they clear the location, it's open for business. If they see a concern, they'll act accordingly.
High Line you mentioned earlier, so.
The High Line, yes, that was
but
on Tuesday.
we'll get to the exact address.
And if I could, we do have the patient's temperature log, and I do know that there was no temperature elevation before that temperature on Thursday morning between 10 and 11. So we can get you the time of the last temperature taken. Was your question.
Right.
But it was taken the evening before.
But I want to just keep emphasizing in the name of clarity. Yesterday morning, between 10 and 11 a.m., was the first time that this patient had a noticeable temperature change, and that was 100.3.
0.3.
Do you have a sense for how many healthcare workers who might be returning from West Africa have come through New York? And are those people being monitored in any way too?
They will be now. I think it's the bottom line is that, look, CDC has obviously indicated that there are 5 airports in this country that people can return through, and that they've indicated the daily monitoring of anyone who has returned, literally anyone, and we will engage in that monitoring at the CDC's direction.
Can you describe his stable condition exactly? Is he walking and talking, and what is being done specifically to treat this guy?
I think perhaps that I should point out that the patient has the right to some privacy in this. He is listed in stable condition, and he is in fact talking and has met with members of his family and so on. But I should perhaps defer to Dr. Raju.
Yeah, I think he's talking. He's talking on the cell phone and to a lot of folks and over a period of time. And I think we cannot tell more than that because of patient confidentiality. But I want to tell you he's stable.
What's being done to treat him?
What kind of treatment is being undertaken?
The treatment is also, I just don't want to go too deep into that. It basically is supporting his electrolytes fluid balance and making sure that his vital signs are monitored correctly.
So let me speak as a layman for a moment. So we have, again, without ignoring the fact that patient confidentiality is a given in every situation, we have someone who is in good enough shape to continually be in conversation with everyone around him, which has been very helpful to us because he's been able to share an immense amount of information to help us with the detective work. Second, a number of individuals now, thank God a small number, have required treatment in this country. We got great news today about Nurse Pham in Dallas, that she has been cleared. We've seen other patients who had the benefit of American health care able to be reached and who have fully recovered. The same occurred with the nurse in Spain recently. So long way to go here, but the good news is that the treatment's being utilized. Obviously, this is one of the world's cutting-edge institutions, and working closely with the CDC, looking at treatments that have already worked here in this country to bring people back to full health.
Mr. Mayor, 2 questions. First, there's some residents from the doctor's house who are wondering how the medical waste that's removed from this residence will be disposed of. And the second question, I know this was being punted to the feds all last week when it was being asked, but given that doctors seem to undergo a particular danger working in these situations, Doctors Without Borders saying about 9 other doctors have died from Ebola, is it time to consider a different form of restriction for those doctors if they do want to come back into the U.S., particularly to
The first one on the medical waste.
So on the medical waste, obviously at the hospital there are contracts in place to work with an established, recognized contractor in removing medical waste. So I think your question was about the building. So you're talking about the apartment building where the patient lived. Now I want to just reiterate that this patient remained asymptomatic for most of his time since he's returned. He developed a fever only yesterday when he had a temperature of 100.3. He reported no watery diarrhea, no vomiting, no loss of control of body fluids. We don't see any possibility of that he contaminated his apartment. There's been a visual inspection of his apartment, and the garbage collection should proceed as usual.
But the apartment, to clarify further, the apartment is isolated right now. It's
isolated,
locked and isolated. That's the only
And no
area.
one's in it. Yeah.
That's the only area in the building where we see any concern, and that's been isolated.
This is about what to do about doctors returning. So the doctors who wear personal protective gear, we know that that works and that people can safely care for patients with Ebola when they have the appropriate training and gear and have practiced, something that I think you're all hearing repeatedly, that we need not only that people have the knowledge, they also have to be drilled and they have to practice. We know with all of that use of personal protective gear is in fact protective, that people can care for people with Ebola. And in Africa, people have logged in thousands of hours caring for people with Ebola. So the doctor used personal protective gear. We don't know what happened, that he became infected, and we may never know what happened. This question about what should be done with returning healthcare workers who've had direct contact with Ebola patients is one that is actively being discussed. It's going to be something that will be decided at federal level.
Mr. Mayor,
Hold
does
on,
the city have
you've had two already. Let me get someone else in. Go to the back left there, all the way. Pointing, that's you.
Hey, how you doing? You had said that people who feel that they may have Ebola symptoms should go to the emergency room. Isn't that the lesson that we learned from Dallas, that you shouldn't go to the emergency room?
No, let me clarify, and then the healthcare professionals will jump in.
Yes.
What constitutes the criteria? You have been to one of the 3 affected nations, 3 only, in the last 21 days, and you have fever and other symptoms. That individual I just described should go to the emergency room or call 911. The difference is, and it's very unfortunate what happened in Dallas, and I think the individuals there, the leadership there of the hospital and of the public sector have been incredibly forthright about some of the missed opportunities and mistakes, and I give them tremendous credit for their honesty. But we've all learned all over this nation how to adjust. Anyone who comes into a New York City emergency room, public or private hospital, and says, I was in one of those 3 countries, I have a fever, there's an instant protocol that takes over. Let the professionals describe it.
I think the most important thing is that every hospital in New York City is able to identify, isolate, and evaluate the patients. They have extensively worked on it. There are procedures which are being implemented. They have been trained on it. They have been drilled on it for the last 2.5 months. So we are very confident that if the best place to go is the emergency department, where we are ready and looking for them, and they know what to do with it. So that is very different from what happened in Dallas.
And further, just let me clarify further. What is the challenge we would face is if someone did not present themselves. So that's what I want to emphasize here. If someone fears they may be in that category, but for some reason holds back, hoping they'll get well, or trying to convince themselves it's not a problem, or saying, I'll wait till I can get an appointment with my personal doctor, which could cause a very dangerous delay and endanger others. And a personal doctor's office is not an appropriate location for something of this seriousness. So that's why we want to make sure people take urgent action, either go to an emergency room or call 911. One very important point to make is no New Yorker, no one here in this city should worry about their documentation status. If they fear they may have been exposed to this disease, they should know if they go into one of our emergency rooms, they will not be asked about their documentation status. That is not an issue. Second, no one should hesitate because of fear that they cannot pay the medical bill. People will be treated regardless of ability to pay. Do you want to add?
And the only other thing to add to that not only is it better for everyone around a person who's sick, traveled to the 3 affected countries in the last 21 days, it's better for that patient. The likelihood of a good recovery is, as we've seen with the management of the patients diagnosed, the healthcare workers diagnosed in both Europe and the United States, that early diagnosis leads to much better outcomes. And so it's better for the patient as well.
In the back.
Other states have stricter measures. Connecticut has this 21-day quarantine. Texas has them not riding on public transportation. Do we have the right measures here? Should we have more strict things like these other states?
I just would say at the outset, I have absolute faith in leaders, and I think it was quite clear yesterday that their preparations were the right ones, and the way that this is being approached is the right way. So we'll continue to look at facts as they come in, but at this point, I think the pieces we've put in play here are the right ones. Do you want to add?
Absolutely. And I think it's instructive for all of us to recall the experience with the household of Mr. Thomas Eric Duncan, the gentleman who is the only person to succumb to Ebola in the United States. His entire household was quarantined. As we've been discussing, he was quite sick while he was still at home. After he'd been inappropriately, we all agree now, sent back home from the emergency department from the hospital. He had diarrhea, he had fever, but no one in his household became infected with the Ebola virus, including the woman who looked after him when he was so sick. So I think that the household was appropriately quarantined, but I think it's instructive always to remember that this is a virus that is easily transmitted. It's not transmitted through casual contact. It is transmitted by contact with a person who's sick with Ebola and with contact with their body fluids.
Mayor?
Thanks, Mr. Mayor. Have there been any restrictions placed on the movements of Dr. Spencer's fiance? And also, has the city been in touch at all with the employees and those who dined at any of these establishments? And are there concerns right now, or are those patrons in the clear?
Let me just start and then pass to Mary. On the question about the three establishments, bowling alley, coffee shop, and restaurant, again, we have OEM and health department personnel at each of the sites. In the case of the bowling alley, it was reviewed and cleared. The other two are going through the process as we speak. In the instance that the sites are cleared, we're saying that we believe, as the patient told us, again, a highly trained doctor explained to us in detail, that no one was put in a position where they could have come in contact with the disease. So that's what we're looking to confirm. Once we confirm, business can continue as usual at those sites. The other part of the question was about the fiance. The fiance is quarantined.
That's correct, yes. So, okay, so there are three individuals who've been served with quarantine orders. These are all individuals who had extensive contact with the patient. The fiance lives with the patient, and there were two friends who spent quite a bit of time with the patient, and they have been served with quarantine orders. What that means is that they are required to be isolated under a commissioner's order for a period of 21 days from their last contact with the patient. Our staff will visit the quarantined individuals daily and take their temperatures. They are all well at this time. And so none of them is sick, but they will be carefully followed with daily temperatures, one of which will be taken directly by staff, the other they'll report to us by telephone, and they will be restricted to one place.
So we have three, just to clarify, hold on a second. We have three individuals, fiance and two friends, all in quarantine, all well, no symptoms, daily monitoring.
That's right.
They do not leave. They do not leave the
leave,
site
that's
that they
correct.
are located at. Hold on. We'll get you. Hang on. Go ahead.
Would it make any sense to have returning Ebola doctors have a blood test? Does that make sense? Or, I mean, before they become symptomatic,
Yeah.
obviously, is it effective? Would you find enough virus in the blood to indicate anything?
You start, and then I'll give the layman's interpretation.
It's a good question.
That's
That's been
a
asked a
good-
lot. Dr. Raju.
It's a good question, but if they're not symptomatic, the viral load will not be enough to test positive. So it will not be positive because they don't have enough viral load in the blood for it to do that.
Right. So, and I just want to add before Mary speaks, look, these individuals who are going there to serve are the people who will end this crisis. Let's be clear. These doctors and nurses and other medical personnel are doing something that this nation and every nation needs them to do. We need to end this crisis. We can't have the illusion that we can turn away from it and someday it may end. If we took that attitude, if nations around the world took that attitude, this would be a truly devastating global crisis. But at this moment, it's isolated to only 3 small countries. We saw a nearby country, I should say, Nigeria, which was a tremendous fear, This disease hit one of the largest cities on the earth, Lagos, and a city known for having tremendous challenges. But Nigeria, with the help of the international community, is now Ebola-free. The same for Senegal. That fight has to be won. The United States military is going to play a tremendously important role in the coming weeks in that fight. But these doctors who volunteer are absolutely essential. And for the good of all Americans, they have to succeed. So we have to make sure that that flow of medical personnel can continue. But I think the key point you just heard in the answer is you can't test. You might want to, but you can't test if there are no symptoms. It only becomes pertinent, it's only traceable if there are symptoms.
Yeah, that's all exactly right. And even early in the disease of a person who has early symptoms of disease, the test can sometimes be negative. There's what is sometimes referred to as a window period when the viral load is beginning to rise, early symptoms have appeared, and for that first 72 hours, when somebody has symptoms and a history that's consistent with Ebola, we would always repeat the test. So it's negative, and somebody who has no symptoms wouldn't help you. It doesn't mean that they're not infected. And even early in disease, it might not help you.
First in the back.
Mayor, one of the lessons from Dallas is that we saw 2 nurses obviously have their immune system compromised by Ebola. These were nurses whose diagnosis came after the original prognosis of the gentleman from Africa. This said, are the nurses that are handling the patient now at Bellevue being restricted in any way? Are they being monitored? Are they being isolated?
I'll start and turn to Dr. Raju. Look, I want to emphasize the way you asked the question is correct, but let's be very, very content today that Nurse Pham has been cleared of Ebola. That's something we should all celebrate, and we are very hopeful for Nurse Vincent as well. And again, the nurse who in Spain, who was in a similar situation, has been cleared. So, the capacity of our medical community to address this issue is extraordinary. And we also, again, learned from Dallas. I think it's clear that Dallas was in a disadvantageous situation at the very beginning of the process. The level of preparation and training and practice here is an entirely different dynamic. And again, you're talking about Bellevue, which is one of the world's most capable hospitals when it comes to challenges and crises. So I think we're in a very, very different situation than what those 2 nurses found themselves in. Doctor?
We have been training for this day to take care of the patient because we knew that it is a global city. One day we will get a patient with Ebola. So we've been training for 2.5 months on this. So the people who are getting trained to take care of this patient right now are highly skilled, experienced, and well-trained nurses. They've been training for the last 2.5 months, putting on the PPEs, taking them off, and making sure what needs to be done. So we are not really involving nurses who are not trained in the PPEs able to do it. So that's a very different story. This is not a place where we are going to have residents, fellows, or medical students involved. It is the care will be given by highly skilled, highly trained, experienced people who are giving the care at Bellevue right now.
Patient right now at Bellevue was highly trained in dealing with Ebola patients in Africa, and he himself got infected. This said, are any of the nurses that are having direct contact with the patient right now in Bellevue being isolated in any way, or are they allowed to go home at night after their shift is over?
No, we need to emphasize the fact that the fact of the matter is this, right? There are people who really, there have been multiple, except for what happened in Dallas, there are multiple areas in which nurses took care of patients. More than 100, 150 nurses took care of all the patients. And they all took care of them, used the PPEs we use right now, and they all never got infected. Patients went home, they never got infected. So I don't know what happened to this doctor in that West African country where he got, the infection. But the fact of the matter is, one thing is we are absolutely certain that if you use the protection devices the right way, every time, all the time, without any break in the technique, it is proven repeatedly that we will be able to keep our healthcare workers safe. So that is why we need to have the right people, following the right protocol, not straying away from the protocol, and making sure that we do it all the time correctly.
Let me emphasize 2 points. One, Dr. Raju is making a crucial factual point here. A number of individuals have been treated for Ebola in the United States of America, have been cured, and a number of people, as you said, hundreds, were part of their treatment. All of those people are well. And so that right there shows a track record and a history in real time that we can depend on. Second, you can't transmit the disease if you're not. That we need our health professionals not only to do the training and the preparation, we need the best people, the most capable people doing this work, and we need to protect them. But they also do have the rest of their lives, and so long as they're taking those precautions, we can make that work.
Time for two more, please. Post office police arrived at the apartment yesterday to find out who the mailman was. There are reports that the guy who did their dry cleaning is saying, "Oh my God, could I get Ebola because I washed his laundry?" So the question I think is, how wide in that, what are you looking at, and how confident are you that the people who may have come in contact with him before he had the fever have nothing to worry about?
So let's start and then over to Mary. Again, I think I think every question that's being asked, I appreciate because New Yorkers are asking the same questions, and obviously I'm going to ask our colleagues in the media to help get out a lot of information here and help dispel myths and help get truths out. It's crucial to emphasize it's not an airborne disease, it's not a casual contact disease. Again, something of a parallel to when HIV and AIDS started, and everyone who was here in the city remembers that crisis and remembers all the challenges, all the questions. And then it became clear that it could only be transmitted through direct, intimate contact, bodily fluids, nothing short of that. So I think the bottom line is that the medical detectives seek individuals who may have had that kind of contact from the time when someone actually was in a position to transmit the disease, which means the onset of fever. Short of that, casual contact doesn't allow for that possibility. So, for example, in this case, what we know for sure, the medical detectives found 4 individuals they were concerned about: a fiance, 2 friends, and a car service driver. The car service driver confirmed and the patient confirmed that there had been no personal contact. It was a internet transaction. No one touched each other. There was nothing. So it led to 3 people. Those 3 people are in quarantine. But unless we find anyone else we can confirm direct, intimate, personal contact with bodily fluids, we would not take an additional step towards those individuals because there's literally no way the disease can be transmitted.
If, for example, say when he was at the bowling alley and he drank out of a glass and somebody washed that glass and they had a cut on their finger, is there a possibility that that person could be somebody your detectives?
And remember, at the bowling alley, he hadn't yet had a fever.
Correct. He was not symptomatic in that way.
Just follow up on that
Okay.
last answer.
Quick question. Coffee shop, the one in Union Square, or you're just generically describing it?
No, not the one in your share. Let me get to it. It was Blue
Bottle.
Blue Bottle Coffee at the Highline? Yes. Okay. Blue Bottle Coffee at the Highline. Again, our personnel are there. And I have the name. Hold on. Okay, go ahead.
And just
All three are clear, but let me get the name. Hold on, one thing at a time. Hold on. The name, we just had the name of the restaurant. Can I get that handed back? Marty, hand it over. Make sure everyone's got accurate information. Here we go. The restaurant, The Meatball Shop.
Which one?
64 Greenwich Street. Okay? The coffee shop, Blue Bottle, literally at the Highline, correct? I want to confirm that. Yes. On the Highline itself? Okay.
Yes.
So we have, it's a stand on the Highline.
History, and as you've heard, that he's a good historian, a very knowledgeable historian, a very accurate and cooperative historian. He's turned over his Metro card and so on. Then we seek to confirm that history. And we ask him all the questions that you've been asking. Who's he been around? What kind of contact have they had? And we try and find everyone with whom he has had contact in particular, people who he's had bodily contact with. And we then try and confirm that the contact was the way he described it, even though we have every reason to believe that he's a completely accurate historian, as that's the language we use. So, for example, the car service driver, he reported that he had no contact with him. We speak to the car service driver and see that that story matches. So at the restaurants, at the bowling alley, at the coffee stand, We are verifying that the interactions occurred as the patient described. Remember, this was at a time before he had any fever. The first fever that was documented by this young man who was checking his temperature twice a day was on Thursday, sometime between 10 and 11 in the morning.
Yesterday.
That was yesterday.
Was there intimate contact between the fiancé and the doctor?
You know, I would guess so. And
Well, let me just clarify. Let's just respect these are human beings and they have a right to their privacy.
Yes.
That being said, I assure you the medical detectives and appropriate personnel have
asked
had
these
that conversation and are acting accordingly.
yes, that's fine.
Okay, hold on. Last question.
Okay, you spoke about that there will be more monitoring now. What happens if you have a patient or a person who traveled from West Africa who's not so cooperative? What do you do? Are health officials checking in on the passenger manifestos from these airlines and then
Let me just
checking
jump in
them?
on one broad gauge point. People have a right in a free society to say what they want and think what they want, but this is also a public health crisis. And we insist upon cooperation in terms of knowing where someone has been and if they have any symptoms, and we have the ability to enforce if need be. Last question.
Mr. Mayor, you
Yeah.
spoke from the airline?
Final question, go ahead.
Mr. Mayor, you spoke earlier about, that you'll now be monitoring these health officials who are coming back.
And any individuals as well.
So is this kind of direct monitoring, something new that has arisen out of this
CDC can
specific
respond. It's a
case?
new protocol. No, it's a new protocol from the CDC.
Sure, and just what does it entail, and does it involve any self-quarantining? Can you just tell us a little bit, and how the city will be involved?
So I'm going to start and pass to CDC and to Dr. Bassett. Again, this is a new guideline. We will monitor anyone who returns from those 3 nations. Our health department, will directly monitor them. Go ahead, doctor.
Who's first? You are.
Yeah. It entails entry screening at the airports for all passengers on flights returning from the affected countries, with screening, questionnaires, temperature checks, and giving them information on, somebody asked earlier, he's a doctor, or information about what to look for, and about the need to be monitored, fever checks, and we're talking about active monitoring with the health departments of temperatures.
So what we used to do.
We've had more questions, and now we're finishing with this answer of how the day-to-day monitoring of people who've returned from those countries goes.
Great. So we used to recommend to people that they voluntarily monitor. In other words, that we would see them, give them information, as Dr. Cavas has said, ask them about their symptoms, check their temperatures. So patients who had no fever, who had no worrying history, were advised that out of an abundance of caution, we recommend that every day you check your temperature. And then that changed to twice a day checking your temperature. And now we're not only going to give that recommendation to them, we're going to call them. And we have the responsibility, we at the New York City Health Department, for New York City residents, but this is going to be done across this nation. So that's what we mean by active monitoring. It's not only voluntary, we actually reach out to the person and talk to them about what temperatures they're measuring.
Daily contact
Daily
by
contact.
our health department. That's it for now, folks. Thank you.
How many people are
We'll have follow-up information for you later today.
Is there a presser today?
Is there going to be another press conference?
Is there going to be another press conference today?
Don't ask.
That's right by you guys.